How do you feel when you are in a public area and you see an individual sneeze or cough without covering their mouths or their nose? You most likely want to walk away and run to the nearest restroom to wash your hands to get rid of any germs that you may have caught that they may have spread while coughing or sneezing. This may also be the case when you come into contact with a person who has just broken out with chickenpox. However, if you encounter a person that has chickenpox, you cannot just run to the restroom and wash your hands and assume that you will be protected from contracting the virus. The only way to receive immunity from the chickenpox virus is if you have received the vaccination for it, or if you've had chickenpox throughout your life and your body has the antibodies for it. My name is Adrienne Lewis, and today I want to talk to you about the importance of receiving vaccination. You or someone you may know may have contracted a virus at some point throughout their life because of failure to receive vaccination. I would like to talk about the need for every person to receive vaccinations, how you can receive vaccinations, when you should receive vaccinations, and also how the important benefits of receiving vaccinations. I will begin by explaining the need for vaccinations in our society. Many people in the United States have not received vaccinations when they were children. In addition, many parents are also not taking their children to get their immunizations. The problem in today's society is that there is not enough information about vaccinations, or they are being misinformed about vaccinations. Disease prevention is a necessity in order to keep the public healthy and safe from diseases that come from the United States and diseases that are transferred from other countries around the world. Vaccinations can shield those who obtain them and those whom the person may come in contact with throughout their life. Some diseases the vaccination control are polio, measles, diphtheria, whooping cough, influenza, smallpox, and the mumps. The most common diseases that we may have heard of in the United States are the influenza and the chickenpox, also the measles. Immunizations are safe. They may come with certain side effects, but the side effects of the vaccine are a lot less detrimental than if the individual would contract the actual disease. A misconception that many people have today is that vaccines are responsible for causing autism in children. Because of this misconception, parents are not vaccinating their children. However, it has not been proven that there's no evidence to support that the vaccinations are indeed the cause of autism in children. Many people will assume they will get sick from receiving vaccinations. This is not the case. Vaccines do contain some of the same antigens for the diseases they are trying to prevent, but by inserting a small amount of the antigens of the disease into the individual, it does not make them sick, but what it does, it helps for their body to make antibodies against the diseases, which protects them throughout their life. It is important to start the vaccination process when a person is an infant. Infants and children are constantly being exposed to germs and infectious diseases by their parents, their peers, their teachers, other family members, and just random members of their community. Children have a very weak immune system, and so it's very beneficial for them to receive vaccinations at a younger age to help them build their immune system. Now that I have discussed some basic information about vaccinations, I would like to talk about how individuals can obtain vaccinations for themselves and for their children, and when to receive vaccinations. Health professionals want all members of society to obtain vaccinations, and therefore it's very easily and readily available to all members of the society to receive vaccinations. Health professionals have even made immunization schedules that people can abide by, and they even keep records of immunizations to make it easier for the patient. Individuals can receive vaccinations by making an appointment with any general physician in their community. All vaccinations are covered by health insurance and are inexpensive. General physicians can provide a multitude of information about vaccinations and answer any questions the patient or patient parents might have about the immunizations. In addition to any questions they might have about the vaccinations, physicians are there to provide comfort to parents and patients who have concerns about the immunizations. To make the vaccination process easy for individuals, health professionals have come up with a schedule which patients are to follow. They can start this process with their or from the time their children are infants, and they also do have schedules for preteens and adults. The recommended immunization schedule is updated at least every 12 months by organizations such as the Centers for Disease Control, and it is the responsibility of all primary care physicians to keep an updated immunization schedule. On the Centers of Disease for Control website, they provide an immunization schedule for children and infants, preteens and teens, and adults that you can easily print out. And today I've actually printed out a schedule, and it just shows you what vaccinations you can receive. It gives you the times and the ages of when they should receive them, and it also gives you information about each disease. It gives you information about how the diseases are spread, any symptoms that come with the diseases, and any complications that may arise from the disease. And these are all readily available online at the Centers for Disease Control website. Primary care providers also have knowledge of the immunization schedule for all groups, and so that individuals can abide by them. Now that I've talked about when and where one can obtain vaccinations and how easily attainable they are, I would like to talk about the most important benefits of receiving vaccinations. There are so many benefits of being immunized, not only for the individual, but also for any persons that the individual may come into contact with. As I have stated previously, it's a lot cheaper and easier to prevent diseases than it is to treat them. It's also beneficial for babies and children to receive their immunizations to protect themselves, build their immune systems, and protect other members of the society. Many of the diseases and infectious illnesses have created havoc on societies in past centuries, but because of vaccinations, outbreaks of such diseases have become very rare. And because of vaccinations, we have been able to prevent the transfer of diseases from other countries, which helps us to stay healthy. As you can now see, vaccinations are an important aspect of every person's health. Vaccinations help the safety and health of all individuals in a society. Today, I have discussed the need for people to receive their immunizations, basic knowledge about immunizations, when and where one can receive immunizations, and the benefits of the vaccination. Next time you are in a public environment and you are standing next to a person who's coughing or sneezing without covering their mouth, think back to the benefits of being vaccinated that I've discussed today. Knowing that you or your children have been vaccinated can help relieve some of the anxiety you feel when being exposed to an individual that is obviously sick.